PT for me is something where everybody wins. You know, you've got the patient needs the help, and their family needs the help, you know, or the client, whatever the case may be. And at the same time, you know, I need a profession.
I wanted to work with people to help them heal themselves, rather than what a physician would do, prescribe a pill or medication. I wanted to heal the wound from the inside out.
It's, you know, the interaction with other people, what I get to do on that front, as well as the fact that, you know, I'm doing some good for society.
Wanted to help people and help people recover and gain their abilities after an ankle injury or a knee replacement or a stroke.
I've always been into athletics, so that was kind of the first thing that drew me to physical therapy, but also just the desire to work with people, and then just the whole aspect of learning about the human body and its interactions.
I was actually involved in an injury that I had acquired in high school, and that made me have to undergo physical therapy. So my 3 months in rehab changed my whole mentality as to what I wanted to do whenever I was of age to actually have a career.
Physical therapy is so hands-on, and you get such positive results, and you have such great relationships with your patients.
I chose to pursue a career in physical therapy because it allowed me to interact with individuals with disabilities on a very individualized basis.
In physical therapy, you get the chance to work with people a lot of times at a crossroads in their life. And as a physical therapist, you often get to stand in that crossroads and help to show them the opportunities that exist down the road of hopefulness and rehabilitation.
I would like to give you a little history about Elon University's physical therapy program. We are a young program. We're about 10 years old at this point in time. We were born out of a need at Alamance Regional Medical Center. That's the local hospital. A formal partnership was formed between Elon University and Alamance Regional Medical Center. About 1 year ago, we opened the new Center for Fitness and Human Movement Studies, and this is a fabulous center where you as a student at Elon will in fact get an opportunity to do some of your learning. It's also a place where our faculty and students are involved in research opportunities, and it's a place where local community clients or patients actually receive treatment. So it's a great addition to our program, and it's a great addition over at Alamance Regional Medical Center to our partnership.
Elon offers a unique atmosphere of giving us really strong facilities in combination with a small liberal arts institution which has a very strong community. So we are well integrated within the institution.
Well, Elon's DPT program really left me with an impression after I visited that this program was about putting good, skilled PTs out into the field.
All the professors were extremely nice, and I knew that there were people that I'd be able to learn a lot from. Because it's not just about teaching material, it's about communication skills and just building your professional persona.
One of the things that attracted me to Elon University was the fact that there was great support across the campus for this program. We are currently in McMichael Science Center.
I find myself standing back and just really being able to take in the uniqueness of such a small school. To be able to have community coffee or things of that nature are totally atypical than what I am used to.
When I came here and met Elizabeth Rogers, the chair, who's such a visionary, just amazing, and the faculty who just were impressive. Their variety of their interests, their skills, and the number of them in relation to the number of students, and the campus, of course, is gorgeous.
I think the number one thing for me is the interaction with the professors. They're all very approachable, very available, and just the fact that you're not only working with PhDs and professors, but you're working with physical therapists as well. They all usually come over to Alamance Regional Medical Center and treat patients, so they're up to date on that sort of thing.
There's a lot more things you can do here. It's more hands-on. We see patients, and this is just the lab here at the hospital that we have. We have 3 separate labs back at school, and all 3 classes actually are always interacting with each other, seeing things. But coming over here, we have different things that they don't have at a lot of other places.
Our clinical experiences are phenomenal. There's a total of a year that the students spend in a clinical setting with clinical instructors who are qualified to provide clinical instruction. They're integrated into curriculum, so when a student goes on the first clinical, they have had the content, so they don't feel like, what is this? I've never done this before. So they feel more prepared than if you just start a clinical. Of course, the final internship, 6 months, they have this wonderful opportunity to do a service learning project where they get to put all the pieces of what it means to be a physical therapist.
The students have an opportunity, particularly now that Elon has moved to the doctoral level program, to go on a couple of clinicals, and then at the end of their affiliation they have a 6-month clinical, which really is key to what makes an Elon University DPT graduate so valuable when they come to work in your clinic.
The first 2 clinicals kind of build you up to getting used to the field of physical therapy, what it's like working with other people, what it's like working with patients, and then once you're on your 3rd clinical, once you get used to that facility, you can really get going and see what it's like to be a physical therapist, from everywhere from the paperwork to working with patients to interacting with other healthcare professionals.
The 2nd year we'll go on 3 8-week clinicals, and I've done 1 so far, and I was in a hospital setting, and I really had the opportunity to go do a bunch of different things. I got to observe surgery and observe inpatient rehab as well as being in the acute care.
And this is where they're taking the information they've learned from their courses, their anatomy, their physiology, their PT sciences, their research courses, and they're applying it then in a clinical manner. It may be that they're doing an interview with a patient, they may be transferring a patient, they may be teaching a patient how to use crutches or cane, that sort of thing. The key to our curriculum is coordination, integration, and also active learning. We want them to be actively involved, not just opening up their brain and pouring the information in.
While you're a student here at Elon, and to graduation and even beyond graduation, we do try and help you feel like you belong here, because we are interested in you personally and academically.